Hello and welcome to Single Pair Radio. I'm Paul Hoppy, broadcasting on the WFMP 106.5 Forward Radio Community Network in Louisville, Kentucky, where news, information, and entertainment is available 24 hours a day, 7 days a week. The views and opinions expressed on our show are those of the speakers and not the station. Single Payer Radio is a project of Kentuckians for Single Payer Healthcare in conjunction with Physicians for a National Health Program through its Kentucky chapter. We produce this program because we believe healthcare is a human right. We advocate for a national, not-for-profit, publicly funded single-payer healthcare system, commonly referred to as Enhanced Medicare for All, covering dental, vision, hearing, prescriptions, and long-term care, covering everyone starting at birth. Catch our programs at 2 p.m. Monday, 7 a.m. Tuesday, and 11 a.m. on Wednesday. We also stream our show on SoundCloud so you can listen anytime. This radio station relies on volunteers like me and your ideas and donations to keep us on the air. Today, Doctors Mike Flynn and Gene Shively join me as co-hosts, and the topic is about when hospitals were segregated in this country. So let's get started. Dr. Flynn?
All right, this is Michael Flynn, a retired surgical oncologist from the University of Louisville Surgery Department. Let me begin with the usual disclaimer. Any comments I make represent my personal views, do not represent the views of the Department of Surgery or the University of Louisville. Gene?
This is Eugene Shively. I'm a retired rural surgeon from Campbellsville, Kentucky. I worked at Taylor Regional Hospital, and I was also on the clinical staff at the University of Louisville. Anything that I say is my own personal view and not that of the University of Louisville or Taylor Regional Hospital.
Well, our topic today is Red Cross hospitals. This is something I knew very little about until we scheduled this program, and I started just looking up some information about it so I could ask an intelligent question. And we have a very special guest today, Steve Lippmann. Steve Lippmann is a retired psychiatrist from the U of L Psychiatry Department. He got his medical degree at the University of Texas, did a psychiatry residency at the University of North Carolina, and he did a program with us a while back on gun violence and school shootings. This was back in January of this year, of 2025. Excellent program. So, Steve, thank you again for coming on, talk about this very interesting subject, which I confess I knew very little about before we got this thing scheduled. We're going to give you an opportunity to make comments for as long as you'd like. And when you're finished, Gene will begin with the conversation. So, Steve, Dr. Lippmann, the floor is yours.
Well, we also talked on this program once about the Family Community Clinic. For the last 10 years, I've been doing primary care at the free clinic on East Washington Street, Family Community Clinic. Anyway, let's get started about Red Cross. Greetings to everybody. Thank you, Dr. Flynn, Shively, and Hop for bringing this important topic to Louisvillians. And Mike, Eugene, Paul, thank you for inviting me. We're going to talk today about Red Cross Hospital. What? I bet most of you never heard of Red Cross Hospital. Most of you never knew there was anything like that. Most of you don't know, or many of you don't know about racial segregation that even impinged on healthcare in America. And probably most of you don't know that there were lots of hospitals all over the country that were specifically designated for African American healthcare. So anyway, that's the bottom line. We're going to start talking about Red Cross Hospital and similar ones all over the country. But first of all, why do we bother to talk about history? Why is that important? The more you know about your history and the more you understand your past, the better you can plan for the future and avoid repeating mistakes, planning for the better. Anyway, that's the advice from the wise people. So before we get into Red Cross Hospital in particular, know that there were hundreds, and I'm going to say many hundreds of similar hospitals all over the country that were specifically and only designed just for Black people's health maintenance, their health care, both acute and chronic. So, acute, like coming in for a heart attack, or chronic, like maintaining your diabetes or hypertension, and also for health education. And all this was going on during the racial segregation days of the 18 and 1900s. There were hospitals like this throughout more than half of the states in this country, and they addressed the medical issues of pretty much anybody who came in. And it is true here in Louisville, we think of ourselves as being progressive, nice people, but we had racial segregation that impinged on healthcare. And Red Cross was just the one hospital here in Louisville of that type to deal with racial segregation. Anyway, um, so these hospitals, when nowadays we call them Black hospitals, and they indeed did provide care for African Americans in this country, particularly when health care was denied. Now, sometimes it would be severely denied, sometimes it was only partially, sort of separate but unequal, maybe a Black ward, or they'd take care of you a little bit in the back and not quite as nice as the others, or there were some places that were not segregated and maybe even rather fair, or maybe in varying degrees fair. But anyway, so we don't know too much about Black hospitals and about segregation and about Red Cross, but that's what we're here for today. Remember that all over this country during those days of racial segregation, that includes hospitals, clinics, blood banks, emergency rooms, everything in healthcare. Now, when you hear it, you say, well, okay, if they're separate but equal, that's not so bad. Well, let me give you an example. Separate ERs, separate blood banks. So you coming into a hospital and you go to the emergency room assigned to your race, and you're bleeding to death, and the doctor determines you're about to exsanguinate, so he calls for blood. If you happen to need A positive or B negative, whatever it was, and your blood bank happened to be out of it, even though the other blood bank might have had a box load of it, you got to die. You can't get that blood because we don't mix the blood. And the tragedy also was, since blood can't be kept forever, maybe the blood that you needed to save your life is about to be discarded the next day or two because it's out of date. So that's how severe some of this segregation was. And you've all heard about water fountains. And the water fountains, there were always two water fountains in public buildings, and one marked colored and the other marked white. I'm not sure if white people had a color, but they were marked colored and white. And I remember that even into my college days, say in 61 or so. Now, in bigger cities, and like where I was from, a lot of the gas stations also had four bathrooms, two women's bathrooms, one colored, one white, two men's, colored and white. So it was a pretty big deal. And sometimes enforced, sometimes it was just by tradition or just a habit. But where it was forced, those were what we call Jim Crow laws. And they were even paying for all this stuff out of public money. And it kind of mocks the 1890 U.S. Supreme Court ruling about Plessy versus Ferguson, where somebody was countering the separation, and the Supreme Court said, no, separate but equal is okay. And of course, it wasn't usually separate but equal. It ended up being separate but unequal. And the sad part, but understandable part, on the other hand, is that we American people went along with it. That's just the way it was. That's how society worked. No, some people questioned it, but that's pretty much how it was. And that moves us to here in Louisville to the Red Cross Hospital. It played a rather prominent role in our regional healthcare system. For most of the 1900s, it was specifically the hospital for African American people for all the healthcare attention that they might need. Now, but before we actually start with Red Cross, we got to go back to 1866. There was a Freedmen's Hospital. Now, the Freedmen's Bureau, some of you have heard of that, right about 1866, went around and helped former enslaved people adjust to their society and come into the dominant society. And the Freed Men's Bureau had a hospital both in Washington, D.C., they also had one in Louisville. The one in Louisville was run by white MDs, but it had very little support, very small resources, and ended up closing in just a couple of years. Nevertheless, it had an influence. It had a positive influence of raising consciousness, making society aware about healthcare inequities. Nothing too much happened, but it was a start. So the next step was Henry Fitzbuller, a Canadian physician who moved to Louisville in about 1872. And he did all sorts of stuff that was plowing the ground for improvement. He started black educative newspapers, advocated for black rights, black health care. He started black organizations and one for physicians like the Black Physicians, the Falls City Medical Society, and something most of us have never heard of, including me before, the Louisville National Medical College for black students. All this is in the 1870s. They ended up graduating 175 MDs before they were closed in 1912 by the Flexner Report. Now, the Flexner Report had nothing to do with race. This is a Louisville connection also. Abraham Flexler, who was from here, had worked on a commission that noticed that American medical schools were not uniformly effective. There were a few good ones, and there were tons of bad ones that didn't really provide medical education. So they closed all the medical schools that year, including the one here. And they had, in order to open, they beefed up Hopkins Medical School, and everybody, with the help of William Osler, had to copy the role model of Hopkins Medical School with teachers to teach, with patients to practice on, with laboratories, with lecture halls. And if you had all that stuff, you could reopen. So that was that was kind of the next step. So we got to give lots of credit to the black MDs all over the country, including Louisville, that advocated for their own community and pushed in their own areas for hospitals to take care of their people. So that is exactly what happened in Louisville. And I want to tell you a little bit how I got this connection. A few months ago, my wife and I happened to be parking along 1436 South Shelby Street, and we saw a sign honoring and recognizing the Red Cross Hospital, saying what they had been doing for 77 years. And the hospital had closed the same year that I moved to Louisville, but that's when I learned about the Red Cross Hospital, having never heard about it, even as a physician. I had never heard about it until 2025 when we just accidentally saw this sign. Subsequently, I know three docs who know quite a bit about it, and Al Golden, a white Jewish physician who actually practiced medicine there years ago. And by the way, like black physicians, Jewish physicians and Jewish patients were sometimes excluded from a lot of hospitals, and has a lot to do with why Jewish hospital originated. Anyway, so I got pretty interested in this topic because I was surprised, but then it reminded me that as a kid, back in the late 40s and the 1950s, on weekends, I sometimes would accompany my dad to the Holy Cross Hospital, which was the black hospital in Austin, Texas. And the interesting thing for all physicians nowadays, and maybe all people, I don't know if everyone, but most of the black physicians in Austin, Texas, rotated charity unpaid care to anybody who was indigent in this hospital or the county hospital or wherever they were, and even in their private offices. So physicians did a rotated schedule where it would be your month or your week to be on for charity care all over the city. I think that was pretty impressive. And that sort of was the other reason I got interested in it. And then the funny thing is, way back in 73 to 76, while I was a resident in North Carolina, I became the Tuesday night regular ER doctor at Lincoln Hospital, which is a similar black facility. It was in Durham, North Carolina, and essentially it was the black hospital for Durham County. There was also a white hospital called Watts. And Duke was pretty close by, just a couple of miles away. University of North Carolina Hospital was only 8 miles away in Chapel Hill. And all those latter ones, including the White Hospital, were already integrated in the 70s. But let's get back to the Red Cross now. So back in the 1800s, in the late 1800s, black physicians in Louisville decided to mitigate in favor of a hospital. And they were even disallowed from practicing medicine on black people in the white hospitals. So ultimately, Doctors William H. Perry, W.T. Merchant, Ellis Whidbey, and K.B. Scott got pushed for having a hospital we now call the Red Cross Hospital. They were the founders of it. The hospital actually began in 1899 in a little house at Louisville's Walnut and 6th Street, just a little place. It only had 8 beds. Interestingly, Walnut Street where this hospital was, now honors a black Louisvillian, Muhammad Ali. So it was at Muhammad Ali in 6th Street. By 1905, they moved to a much better, much bigger, more hospital appropriate building at 1436 South Shelby Street, where that sign was, and ultimately went up to 100 beds. They had much improved services. They did a lot of good medical care for African American people, since the other hospitals were segregated, and they had only a very loose association with other hospitals, and that varied over time. You can imagine the association, let's say, between Red Cross and Louisville General in 1920 was probably hugely different than it was in 1960. They were accredited by the Joint Commission of Accreditation and delivered care for 77 years. There was no affiliation to the American Red Cross. That was just a name that they had picked for whatever reason, but there was no affiliation there. So the black population vigorously supported this hospital. It was a source of community pride, accomplishment, and the people were really behind it. They loved their Red Cross hospital, and the professional staff there, including the docs, provided a lot of the maintenance, the cleanup, the upkeep, and as well as even providing some of the monetary assistance. Now, gradually, Louisville General was, as the public hospital, was slowly integrating, but I'm not really clear on when it did and whether there was no formal date of desegregation, so I don't know the total details, but there were gradually more acceptance of black people in that hospital, but I can't tell you the times. By the time I was here in 76, it was integrated. And we had, and integration included no insurance as well. There were white or black, with or without insurance. And we didn't have black wards anymore at that point when I was at Louisville General starting in 76. Besides having medical care, Red Cross conducted training programs for physicians and also for nurses. They established a nursing school. It was the first nursing institution to offer nursing education to African Americans. And in 1906, that's shortly after they moved to the new building, Mary E. Bennett, RN, became the first black person to become a registered nurse in Kentucky. And she stayed here, practiced in various positions for a long time, was an honored nurse, and was a graduate of their nursing school. Red Cross offered service to anyone, regardless of color, regardless of pay source, including can't pay. Of course, most of the patients were black, but everybody was welcome, including the whites, of course. In addition to providing pretty good care in the beginning, they began expanding, modernizing, growing. They had nice modernized services, opened up more clinics, began to offer subspecialty coverage. And by 1940s, Red Cross became the only private black hospital in the nation to be certified to provide cancer interventions by the American Cancer Society. Now, I happen to know from personal experience that Holy Cross was also a regional neoplastic center, eventually over time, and so was Lincoln in North Carolina. So I don't know why that happened, but it could have been to boost their medical services or to boost their acceptance. I don't know, but they apparently several of them were cancer care hospitals. Um, the next thing kind of on the agenda is as racial segregation began to diminish in severity, and that especially followed the 1964 Civil Rights Bill Act, it says Civil Rights Act, medical services all over the country, including Louisville, began to gradually integrate. It looked kind of promising. It was an exciting time. There was more hope for equality and fairness. There were positive developments. Jewish hospital has started accepting black doctors as attending physicians. Soon thereafter, St. Anthony joined them. Things were getting better. By 53, the Jefferson County Medical Society integrated. Louisville School of Medicine integrated. Um, so things were definitely making progress. Um, in 1956, Louisville graduated its first black physician, Joseph Alexander, and very quickly, shortly thereafter, a black female physician, Dr. Grace James. Grace James, and there is a school here in Louisville named after her. Now, the irony of all this, it's pretty interesting, is that as more racial fairness came in, and as the U.S. economy was getting better and better, and as healthcare was more available, and as Medicare arrived, and Medicaid arrived, and private health insurance and work-related health insurance was getting a wider, more widely spread, and healthcare access improved, the whole healthcare system was getting better. But that basically meant that people with money or insurance went to the hospital, maybe the prestige hospital, and they often chose more often the white hospitals. So people went where they want, and Red Cross eventually and gradually, unfortunately, became the common hospital of last resort, the hospital of last resort for people with no finances or no insurance or that were medically indigent. So at one point, to try to boost the hospital a little bit, they changed the name from Red Cross to Community Hospital, trying to gain more support, but that really didn't seem to happen. Um, So, and a little repetitive here, but the more secure hospitals kept getting more money and the Red Cross kept getting less money. And eventually it went bankrupt in 1976 without money and without much support. Most of the patients in the very end were black or white without money, and the quality had begun to decline in the last few years, as not too surprising. Anyway, the hospital had served the community well from 1899 to about 1976, especially for Black Kentuckians and medically indigent people of any color. And the Kentucky Historical Society erected this memorial sign in Red Cross Hospital honor in 2008. One thing about this, going back a little to the beginning, the Freedmen's Bureau Hospital in Washington, D.C., has now become, has greatly advanced and enlarged and bigger and wouldn't be recognized anymore. I mean, it's a nice big hospital, but it evolved into the Howard University Hospital. So the 1866 Freedmen's Bureau Hospital is now Howard University Hospital in Washington, D.C. And I thought I would just tell you a tiny bit about how Lincoln Hospital got started, the one that I was the ER doc in. Well, back about the turn of the century, 18 to 1900, a group of Black physicians, just like in Louisville, went, in this case, to the Duke family and said, you know, Black people have more infectious diseases and more illnesses than white people, but we work pretty close together. And why don't you build us a hospital? Why don't you donate the money to build a hospital? And that'll make it better for white people. besides that, then we won't be bothering you in the White Hospital, and we'll have our own hospital. And essentially, you can count that as helping segregation. And so Duke built the hospital. Then they got on board. They supported that hospital for the next 77 years, just like the Louisville Hospital. They closed it. They opened and closed about the same date. Anyway, the Duke family then built a brand new hospital about 1952, the one that I actually practiced in. And then they even, some years later, they added a wing, and they remained political, social, and financial supporters of Lincoln Hospital throughout its time. Now, what happened to the Lincoln Hospital? Since by tradition, white people went to the Watts Hospital, black people went to the Lincoln. Finally, Durham County decided to build a brand new hospital in between called Durham County Hospital, and Lincoln turned into a community center, essentially a clinic, and Watts Hospital, the white one, turned into a rehab facility. It didn't have the modern CAT scans and stuff, so it was fine as a rehab hospital. Anyway, but that's how they got on board for integration. And then there's another sort of interesting story about the first black hospital in Houston, Texas. It was called Houston Negro Hospital. Again, the same old story. Black physicians approached somebody. In this case, they approached a rich Texas white oil millionaire and said, "Why don't you build us a hospital?" And he did, and that was the Houston Negro Hospital. And then in 1937, he decided we need to keep this thing going. So he gave an endowment to the hospital in perpetuity, and that has sustained the hospital in good stead, and it still exists. It did change its name, I think, in 1937 to Riverside Hospital. But there are some instances in Louisville and all over the country where black and white people, in one way or another, for various better or worse reasons, did get together and work on that stuff. So that's the main part about the history. Why should we bother with all this history, though? Because what it boils down to, what a lot of wise people have said, if you understand your past weaknesses or your good points, you can more correctly plan for the future, not repeat mistakes. So we could translate that into our discussion today. We can see weaknesses in the past, unfair delivery of health care, and avoid doing that in the future, like not getting rid of trimming Medicare or Medicaid, for example.
Yeah, Steve, that's a great background for our listeners. Gene, do you want to open the floor with some questions?
Yes, sir. I would love to. I want to start off. Did white physicians go over to Red Cross Hospital and provide charity care?
The only one that I can find is Al Golden, who lived within our lifetime. He just died about the first year of Corona. He was 95 then, I think, 94, 90. He would have been 100 years old, but he was one of the hospitals there, one of the white guys that actually practiced medicine in the black hospital. But
Okay.
he's the only one I know of.
What happened to rural Afro Americans who were sick and needed to go to the hospital? In Kentucky, did they go to Louisville? And
if you back up a little, during the slave days, some people gave gave them attention because they were your property, just like you take your dog to the vet, so you call the vet if your slave gets sick.
okay.
So maybe I'm sure it was not as good as the white care, but there was probably some health care of what you hear about in those olden days before 1860. After that, I'm sure in the early, like 1870, 1880, I'm sure it was pretty terrible. But it gradually, around the turn of the century, these hospitals started appearing. And as you heard, the one in Washington started even as early, as 1866. But there probably were places where there was kind of a little house on the corner where people would go. but as far as formal hospitals, there was very little in the rural areas, and people used to come to the cities.
Well, I
Steve?
do
So
know
all
that
the, good,
Ephraim
Mike.
McDowell operated on some Afro Americans. He did some over and cyst, like he did on Jane Todd Crawford, and that's documented. Of course, that was in the early. His Jane Todd Crawford was operated on in I think 1810, and it's recorded that during that period of time he operated also on some Afro Americans for ovarian cyst, and he did other surgery on Afro Americans.
No kidding.
Steve, were the volunteers or the providers, and I don't mean just the physicians, but anybody else, the nurses or technicians in the Red Cross hospitals, was anybody paid, or were they all volunteers?
Oh no, I think they were paid in the beginning, and that's part of the reason they ran out of money because they had unpaid patients, no insurance, no money, but the hospital had to have bandages and whatever.
Sure, if they were paid, where did the money come from?
Well, the only part I can answer there is I know the black community in Louisville, Kentucky supported the black hospital in Louisville, Kentucky. They were very proud of it. And as we said earlier, some of the black physicians even helped financially to keep the hospital afloat. But the black community, I'm sure the black churches were pretty active at doing that back in the day. And all that, in a way, it's kind of like the unintended consequences. As healthcare got better in the 60s, that caused the decline of the black hospital.
Yeah. Now, one more question about the black or about the Red Cross hospitals, and I'll let Gene go on after that. Now, were Red Cross hospitals just in the South, or were they in other parts of the country? Were they in New England and in the Pacific
I
Northwest
know
and
there
places
was
like
some in
that?
Pennsylvania. I imagine the further north you got, the less. But there were supposedly more than half the states in the United States had a black hospital during those days. So there was probably some in New York, and there probably was never one in Vermont, let's say. I'm sure Vermont didn't have one. Probably New York did, but Pennsylvania did for sure, and Washington D.C. did for sure. Anyway, I don't know,
Okay.
but I know that if you look just at black hospitals in general, they were in a lot of places.
Yeah, Gene?
Uh, was the medical school affiliated with Red Cross?
Not any official way, no, not really.
Okay.
I mean,
I was a student at University of Louisville in the late '60s. I graduated in 1970, and the Louisville General was totally integrated then,
yeah,
and of course during the '70s it was also.
yeah, that's the same time that I was there. It was completely integrated. And they didn't have the even separate wards. I mean, the ward was one bed, black, white, whatever.
Right. And I never personally saw any ill treatment of Afro Americans or a substandard treatment. I think the residents took care of them as equals.
It seemed that way to me too, but you never know. You have your biases. But I agree with you. I felt the same way. But I don't know if I'm biased or not. But
Well,
I agree.
the old Louisville General Hospital had 40-bed wards. I remembered that, and they were integrated. There wasn't any segregation in the hospital, at least that I could remember. Do you have that same remembrance, Gene? You were there back in about the same time.
Yes, I do.
Me too.
It was very well integrated, and the nurses and the doctors also. We had some black physicians and lot of black nurses, and I never saw any segregation or people not being able to get along because of race.
Yeah, well, it all started changing in the 60s. So that predates our personal experiences.
Steve, let me ask you a question that is not directly related to the Red Cross hospitals, just because. But as you know, this program is sponsored by Kentuckians for Single Payer, promoting Medicare for All. And I just would like to ask your views about how, what are your thoughts about Medicare for All as a future access to health care in this country compared to the complicated system we have today with 900 for-profit health insurance companies making money out of every healthcare activity, and hospitals, practices, physician organizations being bought up by private equity companies who are all trying to make as much money out of healthcare as they can. So what are your views or thoughts about Medicare for All?
Well, I think that would be a fantastically wonderful situation. I mean, we're wasting millions of dollars on rich people and not providing the health care. I mean, the really crazy thing, to me, the craziest is we're spending multiples as much money as other countries, and we have worse prenatal outcomes, worse prognosis in maternal health, worse declining longevity and higher mortality rates. I mean, we're down on most of the important health parameters compared to, say, Britain or Germany or someplace.
Well, that's because the money that is in healthcare today is not all going to provide healthcare. When Blue Cross and Blue Shield was a not-for-profit, the CEO got paid $500,000 a year, which is not a bad salary. You don't have to, go food stamps or things like that. And most of the money that went into this not-for-profit then was used for health care. Now, today, the CEO of a for-profit health insurance company, United, Cigna, whatever one, Humana, they're getting paid $10-20 million a year. Money goes to investors, money goes to political contributions, and money goes to the administrative overburden of trying to manage this insanely complicated system that is focused on extracting profit out of every healthcare activity. So, the rest of the world has figured out a way at least to provide decent health care for all of their citizens, and at the same time allowing people who want to have private insurance and get to the front of the line, they're both able to function in most first world country health systems.
I can give you a little personal connection. I did my sabbatical at the University of London in 1986, and I had an eye injury. I had a corneal abrasion, a pretty severe one, and I ran across the street from where we lived. There was the GP. He took one look at me, picked up the phone, called a nearby hospital, says, so-and-so is going to come down there in 15 minutes. I said, well, I can't even open my eyes to drive. So a neighbor drove me down there. When I got there in Britain to the Sidcup Hospital in London, they knew I was coming. They were ready for me. The ophthalmologist looked at me right away. They treated me. And as I walked out, I said, here's my health card from U of O, from the University of Louisville. I have health insurance. He said, get out of here, go home. And the other interesting thing there that I can see of a difference, so he treated me. I probably didn't need to see an ophthalmologist again, but in America, you go back to the ophthalmologist. When you have a cut, the plastic surgeon takes out your stitches at a big expense. There, they said, well, go back to your GP across the street. He'll take care of you, and if your eye's not good, he'll send you back. If it's okay, you're done. And I remember when my daughter had a bad facial cut, she went to see Doctors Wolfkill and Yaskier, they said, no, you got to go back to the plastic surgeon. So we go back to the plastic surgeon. He stuck his head in, told the nurse, pull the stitches out. But that cost infinitely more than it would have been in the pediatric office. So we're wasting money all the time on superfluous stuff.
As you know, I've done a study on that, and it's not a real scientific study because it's impossible to get accurate data. But we spend approximately $4 trillion on healthcare in America. And the numbers I come up with, approximately 1.5 trillion of that money is wasted. Has nothing to do with healthcare. And so we could solve the healthcare problem in America with universal health care and providing care for everyone and without increasing taxes if we adequately use that wasted money of 1.5 trillion. And we're just hung up on for-profit medicine and capitalistic medicine. Medicine has never been a business, and everybody thinks it's a business. It's not. It's a profession, and we should go back to that. Unfortunately, this idea of for-profit medicine is increasing right now. Every hospital in Taylor County and all the surrounding hospitals in South Central Kentucky are now, I don't mean hospitals, I mean the nursing homes, are owned by private equity. And I think that's a huge mistake, but that's the way it is right now. I hope that we can turn that around eventually. But on this program, we've interviewed a lot of people, and we've interviewed some administrators. And my cousin, who lives in Florida, has done administrated a bunch of hospitals, now teaching. He says it's not going to change until we have a crisis. We may be getting close to the beginning of that crisis if they don't fix this Medicaid situation.
Well, Gene, this private equity stuff is getting worse and not getting better.
I mean,
they're buying up physician practices. They're buying up hospitals. As you said, they own 60% of nursing homes in this country. And their goal is just to make money. The Hahnemann Hospital in Philadelphia, which was taking care of a lot of the indigent or lower income population, was bought by a private equity company. They sold the hospital and then leased it back to the to the healthcare company that they'd formed. And when that went under, the CEO made a bunch of money by turning some of the hospital buildings into luxury condos. So, I mean, this is, and, I don't know if you were watching the 60 Minutes interview with our glorious president, but I was about to go outside and pound my head on the sidewalk when I heard the stuff he was talking about, and I don't think they have any idea what they're going to do about improving health care in this country.
Well, they want to trim back Medicare and Medicaid. You already know that.
Well, yes, but that I mean. And that's just more of the stuff that Gene's talking about.
So if you don't care about it, that's not a mistake. That's by design.
Yes.
Well, one of the counties north of us is predominantly for-profit medicine now. The hospital is. I know at least one practice is owned by private equity, and the nursing home was recently sold to private equity. So it's rapidly expanding, and we need to do something about it, but I don't think there's a political willpower to do that right now.
Well, the rich people don't care about it. That's obviously what you see is the ones with the power and the money say it's tough luck. We've got the money, we've got the health care. Why should we bother?
Gene, what do you see? Do you remember we had? Oh God, I'm blocking on the CEO of U of L Health right now.
Jason Smith?
Jason Smith. Jason was on, and remember he told us that before the Medicare expansion by the first Bashir governor, with the Medicare expansion, the non-paying population of U of L Hospital, the safety net hospital, went from 20% down to 5%.
That's correct.
And,
Same thing happened in our hospital.
Yeah, and if they continue with this defunding of Medicaid, U of L Hospital will stay open, but I'm wondering what's going to happen to all those little hospitals that are around Campbellsville, who just really don't have the resources or the patient population to provide the services they need to provide. Are they going to close? Or are they just going to turn into emergency rooms? What do you see going on there?
Well, that's actually been studied, and they used Medicaid data on the finances of hospitals in Kentucky. It's predicted that the 35 hospitals in the state could close, and it would include every hospital surrounding Taylor County. Taylor Regional Hospital could probably survive with a very low margin. We're in fairly good shape. There are only 7 independent rural hospitals left in the state of Kentucky. All the rest of them,
How many?
7, and all the rest of them are part of a large group.
Mike, you said they might turn into emergency rooms. I'm going to say they're not going to be emergency medicine. They're going to be urgent care centers because there's a big difference.
Yes, but basically the thing. My point was that instead of providing in-hospital care, maternity services, mental health, they're basically, I guess that an urgent care center is probably a better definition.
Yeah, because they're not going to, if you have a pulmonary embolism, they're just going to say, go to the hospital in Louisville or someplace.
That's correct. Yeah, there are 2 other problems with that. One is OB. Actually, there are only 2 hospitals in our region now that does OB. When I moved back to Campbellsville in 1978, every hospital around delivered babies. Most of it was done by family doctors. Some hospitals, the general surgeons did the C-sections. It was my opinion that they were doing a good job. I don't have any statistics back in those days. But the problem now is that both the hospitals that are delivering babies are struggling. The cost to deliver babies is phenomenal, and the reimbursement is below the cost. Most of the babies being delivered are their mother is on Medicaid, and they don't reimburse the cost. So that's going to get worse. If those 2 hospitals were to stop doing OB, patients would have to go 50 miles for deliveries. And as you can imagine, that can be quite a problem. In the 70s and 80s and part of the 90s, there was somebody around who could deliver a baby, but I'm not sure there's anybody around who deliver a baby or who would want to deliver a baby right now in an emergency situation. I'm sure, if the baby was being delivered and no problem, then they wouldn't have a choice. But if you had a complication of pregnancy that required a very urgent C-section, I think those patients have to be transferred, and that could create a problem.
Gene, how much of that issue related to pregnancy, dealing with the complications of pregnancy, have to do with the anti-abortion laws that we have in this state right now?
Well, the main problem it's created is the complications of pregnancy.
Yes, exactly.
And there's been several things that happen to that. One is a second trimester complications. For example, ruptured membranes. Right now, there's nobody in the state who will deliver those if they're in the first part, like 13 or 14 weeks. And there've been several babies that have been transferred out of state, like to Cincinnati, and I know one was transferred to Chicago. The other problem is what do you do? A patient comes in with a miscarriage, and they've got a 12-week baby with the feet hanging out, and there's still a heartbeat, and the patient's bleeding. Obviously, that child's not going to survive, but under the current laws, it's my understanding that you can't go ahead and deliver that fetus because the law says if you still got a heartbeat, you've got a live baby. And the other problem is that senior medical students are doing residencies out of the state because of the abortion laws. We've actually lost some OBGYN because of the abortion laws, and people who are doing residencies here are going to other states. So it's created a severe shortage. We've had a severe shortage here in Campbellsville. Right now, we corrected that, but it's costing a lot of money, and I don't know how long you can persist at that. And then not only do you have a lot of cost in paying the OBGYN, but the liability is sky high. So we've got a real problem. And it's something that should be easy to solve, but it's not. Now, I have a friend who lives in Indiana, and he knows a family doctor who delivers baby. I don't know of any in the state of Kentucky who does that. I don't think they could afford the malpractice insurance.
Well, the state of Kentucky is becoming a maternity desert like Idaho. Steve, I know this is not out of your ballpark, but what are your thoughts about the issue with the anti-abortion laws in this country and the ability
to? In Bloomington, the medical school in Indiana, the OB/GYN residents all said, who knows what they're going to actually do, but the current group of residents said, we don't plan to practice medicine in Indiana. It's too much of a burden. And then my daughter is an emergency room physician in Rhode Island, and she's in a trauma 1 center, so she sees all the ruptured tubules and all that. And she says, it's just amazing because when I have a ruptured tubule, I can get an obstetrician down there in 3 minutes, and the patient's on the table getting fixed in a minute. And if they're across the border, or they're in Indiana or Kentucky or Texas or someplace, they got to go to the waiting room, then tell the husband when she passes out or can't talk anymore, then bring her back, and then we'll take a look at her.
Yeah, that's right.
Let's get back to the subject of the Red Cross Hospital. I want to ask, my final question is, if for somebody in the audience who's more interested in this subject, can you tell us where they can go to get more information about the Red Cross Hospital?
Well, look on the internet at the National Medical Association. That's the Black Medical Physicians Association, the Kentucky Department of Public Health, the Filson Club. The CJ has stuff on when hospitals opened or closed. Uh, if you just look even at Jefferson County and Kentucky healthcare, the Louisville Public Library probably has some. I don't know specifically about that. Uh, oh, by the way, I have an article being published in Louisville Medicine in next month, yeah, in December on the Red Cross Hospital in Louisville Medicine. It's already been accepted. They've already agreed to publish it this coming month. So there's another source. But if you look on the internet, it's just amazing. If you just say black hospitals, I mean, all sorts of stuff pops up.
All right, Steve, you want to make any last-minute comments before Paul takes us out?
Well, I think the main comment is we did bad health care. We shouldn't go back to it. And we are sliding into worse health care. I mean, look, suicide rates are going up in America. We're not doing a good job with health in America.
I absolutely agree. Unfortunately, we need to get that information into the brains of politicians, and things are not looking good in the immediate future. Paul?
Yeah, I'd just like to say that as of yesterday, this country has started a new grand social experiment. And I think you guys probably know what that is. It's the election of a new mayor in New York City. So there may be some hope there. It depends on how that experiment goes.
Well, I hope that those elections that were held yesterday are what's going to happen in the future, because otherwise we're really in trouble.
So
Steve,
maybe we're gonna go ahead and have a war with Venezuela and not have to focus on it, not worry about it. Want to be war?
Steve, thank you.
What do governments do when they're having internal trouble? You have a war with somebody.
Well,
Exactly.
we've done that in Afghanistan and Iraq, so we know about that. I want to thank you for coming on and talking about the Red Cross hospitals and some of the other things we talked about. Hopefully, our listeners have learned a lot, and I hope they will take this information when they go to the voting booth.
Thank you, Dr. Flynn, Dr. Shively, and Dr. Lippmann for providing today's program. And a special thanks to our listeners for tuning in. If you'd like more information on single-payer healthcare, please visit our website on kyhealthcare.org. This is Paul Hoppy with Kentuckians for Single Payer Healthcare, inviting you to listen to more of the wonderful programs that we broadcast here on this station, and wishing you a wonderful rest of your day.